The disease atrial septal defect is an abnormal communication between the atria due to a defect in the interstitial septum. And the type of ASD is Scandum ASD 75%, Ostium premium ASD 20%, sinus venosus ASD 5%, and coronary sinus ASD less than 1%. So what is the pathophysiology? Pathophysiology: increased left atrial pressure, oxygenated blood lead to left to right shunt. There is no cyanosis, and that shunt lead to burden on right side of the heart. And whenever the increased burden of the right side of the heart will lead increased pulmonary blood flow, and that blood flow increase create pulmonary stenosis, or we can say pulmonary hypertension. Hypertension lead to right ventricular hypertrophy, and this hypertrophy lead to increased atrial pressure, and whenever pressure is increased, right to left shunt, and will create cyanosis. The clinical features is majority remain asymptomatic. Systolic murmur best heard over second, third ICS. Dysarrhythmias, increased vegetability. In older children, recurrent chest infection, breathlessness, bulging of the chest due to enlargement of right ventricle, and growth failure in some children, which is called failure to thrive. Diagnosis measures chest X-ray, ECG, electrocardiogram, MRI, heart, cardiac catheterization, which is used to examine how much size is there, length and size for examining. Intracardiac imaging with the special catheter that are typically placed in the venous system and advanced to the level of the heart, involve only mild sedation.